Welcome to Eye Spa Talk, where we educate, empower, and encourage women to practice safe beauty habits, starting with their eyes and skin. I help you connect the dots between beauty and science. Some say your eyes and skin say more about you before you open your mouth. My name is Dr. Janelle O.D. I'm your host and the CEO and founder of Winterize Vision Center and Premier Dry Eye Spa. Thank you for tuning in. Let's chat. Hey, happy Sunday. Happy first Sunday of the month. This is Dr. Janelle O.D., the Dry Eye Mentor, the host of Eye Spa Talk. I am the CEO and founder of Winterize Vision Center and Premier Eye Spa, and I'm so excited to be here with you today. We're going to have a special guest with us today. We're going to talk about how to winterize your eyes and your skin for the winter season. So this is right on point, considering we just turned our clocks back, and so that means we're falling into fall, falling on into winter. So this is going to be an important message to be able to make sure that your eyes are ready for the winter months and your skin. I'm going to bring in our guest, Shabri Robinson. So let's add her to the stream. Hi, Shabri.
Everybody. Hi, how are you guys doing?
We are great. I'm so excited to have you here. Before we jump right into our call today, I'm going to just go over some of the particulars. If you have any comments or questions, go ahead and put them in the chat box. I will eventually get to them. Some of the streams, I think it's my personal page. If you're on that one, the messages won't show. So if you want to be able to ask a question, then you'll need to go either to my LinkedIn page or to Dr. Janelle O.D. on Facebook. That way you can put your questions in and we'll put them up top. So that way we can all answer your questions. So feel free to answer questions. Tune in about midway through. We are going to do a raffle. So be thinking of your number 1 through 20. We're going to raffle off a free Hydrofit Facial, which we'll talk about more today. And we're going to raffle off a dry eye kit. So hence we're getting your eyes and your skin ready for winter. But for those of you who do not know, I am Dr. Janelle Davidson. Like I said before, I'm the CEO and founder of Winterize Vision Center and Premier Eye Spa. I've been practicing optometry now for 15 years in Atlanta, Georgia, 11 of those years as a private practice owner. In 2018, I implemented an eye spa in my practice. I'm going to talk about what that is in a moment. And we're so excited to relaunch our eye spa in 2021. So we'll get started. First, we're going to talk a little bit about dry eye. So come on in, tag your friends. This is important. Dry eye is kind of like a buzzword. But it's more than a buzzword. A lot of patients come in saying that they have dry eye, or they've been diagnosed or been told that they have dry eye, their parents or family members have dry eye. But I still don't think people really understand that dry eye is a legit eye disease. And there's so much more that you can do for dry eye than just tears. There's so many patients taking over-the-counter tears that have either been prescribed years prior or they're self-prescribed and going over the counter. And not all tears are created the same. So let's just talk really quick. Dry eye, yes, Amanda, dry eye is tough and painful. And so that's important. I am a dry eye sufferer myself. I've had dry eye now since about the mid 2000s. I was diagnosed actually in optometry school, but so much has changed in the last 10 to 15 years that there wasn't a lot of treatment options for me those years ago, other than tears. But dry eye speaks to the fact that your eyes are they're not hydrated. And you have to figure out why they're not hydrated. There's a root cause of dry eye. And we know so much more now with research and studies and workshops that we know now there's two main components of dry eye. So you can have evaporative dry eye, or you can have aqueous deficient. And so let's break those down. Evaporative dry eye means that the oils in your eyes don't work well enough. So the glands that produce the oils aren't functioning, or they're not producing enough oil, or the oil is so inflamed that your tears that you make don't stick to your eye. The oil is needed to make the tear, the water part, stick. If you don't have enough oil, it's not going to stick. And so if it doesn't stick, then guess what? Your eyes are going to be dry. A telltale sign that your eyes may be suffering from evaporative dry eye or dysfunctional oil glands is if you walk outside and it's windy and all of a sudden you just start tearing, like you just got some really bad news. Guess what? That's not normal. That means that your tears and the oils are not thick enough to combat that change in element. Or if somebody turns the air conditioner on or the heat in the car and all of a sudden your eyes just start profusely watering. That's not normal. That's probably the oils in your eye that are dysfunctional. And guess what? There's tools now that we can evaluate those structures to see if they're working. And so we have those tools in my office, and so many offices around the country now have those tools. Just like glaucoma, we can do testing to find out exactly what's going on and what's causing your eyes to be dry. The other type of dry eye is aqueous deficient. So that means you're just flat out not making enough tears. So you have oil, but your tears, you're just not producing enough tears. There is a gland that makes tears, and it's called your lacrimal gland. And typically, if you don't have enough aqueous or water part, then that means that gland may not be functioning to full capacity. We do know most people, about 85 to 90%, have the oil gland or evaporative dry eye. That smaller percentage is aqueous deficient, and that's usually associated with a lot of your autoimmune conditions. So specifically like Sjogren's syndrome, you may have some issues with that gland, and you're not producing enough oil. And a lot of times we don't know. We can't just make a diagnosis. In most cases, just off of your symptoms. So it's important for a patient to have a full dry eye evaluation. And if you're lucky enough, you're a person that has a hybrid. You have a combination of both. You're just not making maybe enough tears, and the oils, you have some glands that are clogged and not functioning properly. So therefore, you are like a hybrid. And sometimes you don't know that if you're self-prescribing and just taking tears over the counter, or if somebody told you years ago, like in the mid 2000s, like myself, that you have dry eye and they just told you take tears, because that's literally all you can do 10 years ago. Now there's so much more than just doing tears. It's important to find out what category you fit in and have a treatment plan that's set for you. Because guess what? If it's not treated, then yes, it's tough, it's painful, it's irritating, it's debilitating. I'm in some Facebook groups that are for patients that a patient has started, and it's a group of patients who all suffer from dry eye disease. And there's thousands of people in this group. And I just kind of sit back in a group just so I can get a better understanding of what people in real life are going through with dry eye. And it is debilitating. If you've gotten to the point where your eyes are severely dry, it's like having severely dry skin and you're not allowed to moisturize your skin, or severely cracked and dry lips. That is not fun. I mean, I've had dry lips and I can't find a chapstick. I don't know about you, Shabri. I'm going to find a CVS, Walgreens. I'm going
Exactly. A
into the
gas
store.
station, something.
Exactly, because you can't eat. You put some hot
Right.
ketchup, it's burning your lips. I mean, it's not
Mhm.
comfortable. So just imagine
Right.
if that was your eye like that, just severely dry and uncomfortable, and you just can't find the right combination to make them comfortable. One of our guests on here said IPL is a game changer, which we're not going to talk a lot about IPL, but it's called intense pulse light therapy. And it's one of the new treatment options that is out now for patients who are suffering from dry eye. And yes, it is a game changer. We do offer that in our Premier Dry Eye Spa as one of our dry eye treatments. But what you want to take away from this little short spiel is that dry eye is a disease, and it can lead to inflammation of the front part of the eye. It can lead to damage of structures in the eye if it's not caught and treated properly. So there's more than just tears. You just have to find out who's able to diagnose and properly treat your dry eye disease. And so let's get into it. What are some tips that I can give you to get your eyes ready for the winter months? Simple. Like I say, when people ask, what are some things I can do to protect my vision? I mean, one, get an eye exam. You shouldn't be doing anything self-prescribed or get any information out of Facebook groups. So if you think that you might be suffering from dry eye, you're not quite sure, then you need to have a dry eye consultation with imaging and scans and dyes. Preferably, you want to go to a dry eye specialist or expert, because they're going to have all the equipment and tools needed to diagnose you as well as treat you. You don't just want to be treated without being properly diagnosed. And so get an evaluation. That's number one. You don't want to go through the winter suffering, get an evaluation. Number two, some simple things. Drink water. We associate drinking water, in the summer, it's obvious. When you're outside, you get dehydrated pretty quickly. So we all know, carry your water. If you're out at Six Flags or whatever, you have your water bottle. Winter is no exception. And I'm sure Shabri can attest to this too. If you are dehydrated inside, then your skin's not going to look good. Your eyes are going to be dry. So you need to be drinking enough water throughout the day. Don't associate just drinking water with when it's hot in the summer, but you need to do the same thing in the winter as well. Also, we know lid hygiene is important. So any hygiene is important. Like washing your face, I'm sure that's going to be helpful. I mean, you don't want to get all these special treatments if you don't wash your face in the morning and at night.
Right.
Brushing your teeth is hygiene. So you go to the dentist, you brush your teeth at home. That's a homework you have to do. So now we know there's a lid hygiene. There's normal bacteria that lives all over your skin. Your eyes are no exception. They live over your eyelid, eyelashes. So we know now proper lid hygiene nightly, and if you can, twice a day, it's going to minimize the overgrowth of bacteria on the eye. And that bacteria can affect those glands that we talked about that produce oil. They can make your eyes red and irritated and itchy. So it's important to have proper lid hygiene. And once again, you want to consult your eye care specialist, especially a dry eye specialist or anterior aesthetic specialist, on what proper hygiene to use. But a lot of times we recommend formulations that are safe for the eye of tea tree oil, and keyword safe for the eye. I do not want you to go downstairs in your pantry or in your beauty stock and pull out some tea tree oil and start putting that on your eye, because Dr. Davis did not tell you to do that. You want a safe concentration of tea tree oil. We know hypochlorous acid, which is good, which is naturally produced by our body. And so there's various ways that you can manage the bacteria on the skin, but you want to consult your eye doctor. And then lastly, warm compresses. Warm compresses do a lot. Not only are they relaxing, but warm compresses on the eye over a closed eyelid can help those oil glands stay stimulated. Like we talked about, those oil glands need to produce oil. The oil needs to be liquid. We don't want that oil hard and crusty and looking like toothpaste coming out. So you can do simple warm compresses, not with the face cloth, right? Because that harbors bacteria and it's not going to be hot enough, because you got to run it under water. That's not going to work. You want a heated mask with special beads that can heat up easily in the microwave. And so once again, you want to talk to your eye care provider, especially preferably a dry eye specialist that can recommend the proper lid hygiene and cleaning product for you. Oh, so Amanda said, this is a good point. Yeah, lid cleaning. There's several devices out, Amanda. Yes, new lids is great. I recommend new lids as well. There's one Myo Clean. And there's another one that's going to be coming out that I'm going to recommend in my office. It's combining hygiene and warmth at the same time. I do a lot of dry eye treatment, and in the treatment programs, I recommend warming compresses. A lot of times us Americans, we're so busy, I guess, we can't figure out how to get 10 minutes in our day to warm our eyelids. And so I'm working with the company, and hopefully by the end of the month, I'll have it in my office. But it's a pad that has hypochlorous acid, and it's so you heat it up and it stays heated for the concentration that we need for about 6 minutes. And so that way you can clean and warm at the same time. So it's going to be a game changer for patients to be able to do those things that's recommended by their eye care providers. And so new lids, like there's so many things out nowadays to help patients that are suffering with dry eye. It's important that you get in and you find out what option is going to be best for you. Take another thing to remember is that dry eye is chronic. Amanda, which you may know, there is no cure for dry eye disease. It's chronic. There's ups and downs. And so another reason is their dry eye flares, and that's going to help you get ready for the winter. We know now from research that patients who are being treated for dry eye and managed and controlled for no reason, they'll have flares, meaning you're doing everything you're supposed to do. You're following your doctor's recommendations, but a couple times a year, you notice your eyes just go haywire. And we know now those are called dry eye flares, when you have an increase in inflammation or something's just offset. And there's medications and things for that now that I prescribe for patients who are my dry eye patients, that I call that their maintenance drop. And that you use as needed when you have these flares. And so that drop is called Isuvis. I do not work for this company, so I don't get anything for mentioning that name, but that just goes to show what options that are out there. And there's so many things out there now for patients that are suffering from dry eye disease, from topical therapy, in-office treatments, and home therapies. And then lastly, manage what you're eating. Dietary is important. No difference for the eye, just like the skin. I'm sure Shabria mentioned that as well. You are what you eat. I'm still I work in progress, because I love me some French fries. I know starch and fries and grease, not good for my skin. And it's not good for your eyes too. So a lot of processed food is not good for the eyes. But for the front part of the eye, it definitely helps if you have a concentration of omega-3s. Omega-3s is different than fish oil. You want omega-3s. There's a special ratio with omega-3s that you want to have that's important. It's called EPA versus DHA. And so you want to have a really good ratio of EPA versus DHA. For dry eye, you want the EPA, which is a ratio. So you look on the back of your bottle, it'll say EPA, DHA. And so if you have like a 1200 milligram dosage, the EPA should be between 70 and 80%. And so you need a high concentration of EPA that's going to help manage the inflammation. That's going to help with the oils in the body. So a lot of times, a lot of your over-the-counter inexpensive omega-3s are not going to hit that. And so usually if you're with the eye care provider, especially a dry eye specialist, we have our go-to omega-3s that we like. I like omega-3 coupled with omega-7 because we produce omega-7. So if you introduce that as well, it allows the omega-3 and omega-7 to get into cell faster, so you get relief faster. And so those are some simple things that you can do. One, get your eyes checked. Two, lid hygiene, warm compresses, water, and omega-3 supplements. A quality omega-3 supplement. You don't want one that is cheap. Patients had a patient ask me, a couple of vitamins that I recommend. She says, in more than $19. And I said, yes. Typically, the vitamins that I recommend are going to be anywhere between $29 and $39, sometimes for a month or 2 months supply. But I recommend because it's going to be good for you. It's not going to have any alcohol on it. It's going to go through those next steps that they're purified. A lot of inexpensive vitamins are alcohol based. And guess what? The body does not like alcohol. So you're going to be taking that stuff and the body's just going to reject it. So you're just wasting your money anyway, because the body's like, not absorbing this. And so that's why you don't notice any difference in the way that your eyes feel. And so Amanda says a whole 30 for me. Yep. Yeah, so dietary. And so Amanda says she goes to Dr. Perryman. And so, yes, if you go to a dry eye specialist, we know that it's just not going to be in-office treatments. It's going to be a whole modification of your lifestyle, very similar to patients who suffer from diabetes or any other chronic condition. You are managing it, we're treating it, but a lot of times there are a lot of lifestyle modifications and changes that need to be made in order to keep you healthy. And so that's going to help us segue into what is an eye spa and what does an esthetician have to do with dry eye and the eye spa. And so in 2018, I started an eye spa in my office. And when I started the eye spa, it's because these things that we're talking about, I have these same conversations in the office with my patients. And so a lot of the patients will say, well, where can we get this information? Where do we purchase this? Patients ask me about dark circles under their eyes, anything that they can do as far as help with anti-aging, any creams. They're asking me about mascaras and eyeshadows and you name it. They were asking me about it. Skincare. One, because optometrists, we're not super busy. A lot of doctors are seeing so many patients a day, they can't spend that time with you. Most optometrists, we're not seeing that on that level. So we can spend a lot of time with our patients so they feel comfortable asking us questions. And with me, a lot of patients know that I stay up to date on a lot of research and technology and things that are out. And so I will make these recommendations. And then always the follow-up question would be, well, where can I go to have these services done? And then that's where I would just be like, that's a good question. Where can I go to have these services done? And so then, I didn't have time to go find an esthetician that I could say, I can refer people to you and, find all this makeup and stuff and where to send them. And so a patient was like, Dr. Davidson, why don't you offer this stuff here? And I'm like, never thought about it. And she was like, if you offered, a place where I can have facials that I know things are going to be used that are safe around my eye, especially if I have dry eye. If you sell makeup, if you sell mascara, skincare, I will feel more comfortable getting it from you because one, I know you have vetted the things and that you're not going to have anything in here that you don't stand by and that you won't use yourself. And so I was like, okay, I never thought about that. And so I was in my previous location back in 2018. And I was like, okay, if I was to do this, where would I put this? So I ended up converting a space, which was my office, into a spa. Then we relocated in 2020 and I made sure that I had a space in my office for a spa. And so I coined the term an eye spa. An eye spa is just basically an intersection of clean beauty in eye care. And so in the spa is where we do a lot of our advanced dry eye treatment services. So someone on here mentioned before IPL. So intense post-light therapy, we do that in the spa-like setting. We do mybo therapy. So all of our dry eye therapy we do in the spa-like setting. So that way you can get your eyes treated, but you can get a little time for self-care. And then the intersection of clean beauty and anti-aging is when we have our esthetician come in and offer things that are going to help contribute to what I'm doing. I want to make your eyes clearer and whiter. And then all of a sudden, those dark circles in the skin that looks dry, all that stuff stands out even more. And so now we have somebody that we can collaborate with to help with those things as well. So an eye spa is just basically an intersection of dry eye and clean beauty. And we do all that under one roof. And so that brings me to my esthetician buddy, Shabri Robinson. She is our lead esthetician, lead Georgia licensed esthetician for Premier Eye Spa. And so, Shabri, just tell us a little bit about yourself.
All righty. Like she said, my name is Shabri Robinson. I am 27 years old, originally from Florida. I spent half my life there, half my life here in Georgia. Yeah, I love aesthetics. What originally got me in aesthetics is I seen the potential of money that I can make. Not gonna lie. But then as like an aesthetic student, learning everything that I did learn and having the opportunity to actually perform treatments on different clients, I realized that my love went beyond the financial aspect. I actually loved the fact that I actually changed the way people look at themselves, how they feel, their mood, their confidence. That's what I really actually fell in love with. So yeah, that's why I'm here.
Well, definitely, that's a good thing. It's kind of like it falls right in with eye care. How people feel about themselves, change their outlook. Just like when we prescribe glasses and contact lenses, people are like, oh my gosh. Same with dry eye. And so that just falls right in line with what we're doing. We change the way people feel about themselves and their appearances. And so talk a little bit about what made you want to partner with us and Premier Dry Eye Spa.
So for me, I've never heard of a spa or seen a spa in an eye doctor's office. You know what I mean? So it was just the unique opportunity for me, and I wanted to try something different, and gain the knowledge from this experience, and potentially, create my own little space where I can have my clients come. And when we got together the first time, I realized that you were very invested in whoever you decided. And that's why I feel so lucky and blessed to, be under your wing and potentially gain so much information from you. So
yeah, and you're right. It is unique. We're excited to have you here, and I try to impress upon her. This is unique. In Atlanta, I don't know a lot of other doctors in Atlanta is doing it. In 2018, there weren't many optometrists across the country at all. We were featured in one of optometry's top podcasts, Defocus Media, for our venture in 2018. But since then, many optometrists across the country have, figured out it's a great way to collaborate, great way to increase patient outcomes and create a unique experience, as well as facilitate relationships with estheticians. There's so much that you guys have to offer, so much we have to offer, and we're all working around the same space. So if we could collaborate together, like I said, it will definitely help increase patient outcomes on treatments, on also how they feel and look at themselves. And so let's talk a little bit about some of the facials that you offer. And so we wanted to relaunch. And so in our previous spa, we did a lot of lashes, individual lashes. And y'all, I'm praying on that. I have to talk to Jesus on that, because the more I get deeper into what I do, the lashes, y'all, they're not right. Okay. And y'all don't do right with the lashes. And so I was like, if I do it under a clean space and I monitor them, it's just like having bad kids and they bad and you won't think no. And so I'm gonna pray about that. So right now we don't do lashes, and I don't know if they will come back. If I offer lashes, it probably would be magnetic lashes. I'm all about clean beauty at this point. And so I gotta, practice what I preach. And so we wanted to relaunch with focusing on enhancing those dry eye services, as well as enhance dry surfaces, as well as working on anti-aging, particularly the skin and tissue around the eye. And so let's talk about some of the facials that you offer and just give a little bit of tidbit on each one and how it will be beneficial for a client.
Okay, so first we have our signature facial, which is basically like our baseline facial. It is a simple treatment, but it's also beneficial because you do get those the products that I use that you may not use at home. So my products are, professional grade, so that would be beneficial for someone who doesn't or may use some things at home, but they need, to take it up a notch. We also do our customized dermaplaning facial. So during this treatment, I'll use a tool to basically exfoliate the top layer of the skin and those vellus hairs, which is like the little baby hairs you see on the face. This is causing control trauma. So that'll kick those cells in the low, the bottom, I don't want to say the bottom layer of the skin, but the lower layer of the skin into overdrive. And then that's where you see the new skin starting to come in and that glow. That's where you get that from the exfoliation. We have a hydrofacial, which is meant to cleanse and remove debris from the skin, and also, excuse me, it increases the elasticity of skin. Um, with the our next treatment, which is our oxygen facial. Um, excuse me. Our the oxygen facial uses special serums that will be used to moisturize the skin. I use this little spray gun basically to add that moisture, and it will help the serums penetrate at a deeper level, um, which means better product penetration for the serums so that it could be more effective. And then we have our tightening facial. So in this treatment, we use ultrasound and radio frequency technology in order to stimulate collagen production and also to lift and tighten the skin. So this treatment also helps provide deeper penetration of the products, and it'll help repair those lower layers of the skin as well.
So definitely more customized facials with the
Right.
results as goals. And so very similar, I would assume, like when we do a lot of our dry eye treatments, we don't expect results overnight. So usually with these
Right.
treatments, we have so many treatments that we recommend. So most of our dry eye treatments is at minimum 4 treatments that we
Mm-hmm.
recommend over a time frame to ensure that you get the best outcome for the longest period of time. So is it that
Mm-hmm.
the same concept when a patient is picking one of these treatment services for their skin?
Right. So, of course, you're not, if you wash your face today, you're not going to see a difference tomorrow. You'll have to
Mhm.
come back in for, I would say, 4 to 6 treatments to actually see a difference in your skin and actually meet your treatment goals. Yes.
So we have a question. Someone said, how do you determine which facial is right for you? So how does a
So,
person determine which one they should get?
so this is when you need to actually come in and actually see the esthetician or myself. Um, So we start off with our pre-cleanse, and then we go into a skin analysis. And what that skin analysis is going to do is going to tell me how your what type of skin you have, what treatments will be best for you, what products I need to use, and so on and so forth. So to determine that, you'll just need to come and see me.
And so I would say, I would assume that, I've had all of them. I'm saying, and I'm already overdue. I'm like, my favorite was I like the hydrogen and the oxygen. I liked all of them. And so I
Right.
guess for me, asking for myself, and I'm sure somebody else will get some knowledge, can you couple those facials? So can you like, okay, if your goal is to tighten your skin. I'm
Hmm.
not young, but the 40s is rough. Stuff starting to sag and droop. But then I like the hydrofacial. So is it like you buy, you do so many series of this, so many series of that? Can you do all of them at the same treatment? Like, how does that work?
I wouldn't recommend all of them in one treatment, but you can combine some.
Okay.
All depending on what your skincare goals are, is what, of course, you would combine. So if you want to tighten your skin, our tightening facial of course, will be the number one go-to for that. But if you also want, um, just say you want to have a super duper dewy and glowy look, I would say you can do a tightening facial this time and then come back and do your dermaplaning facial or come back and do your oxygen facial. It's different, you know, different things for different goals, but you
Okay.
can couple them.
And so, what is the cadence? And so, for dry eye treatment, especially like if we're doing an IPL, there's a certain cadence that we go. We do one treatment here, one treatment there, a gap, and another treatment. So, how often should you get a facial if you decide, okay, this is what I want to do, this is how I'm going to do self care? How often should we get them?
You can honestly have a facial, like our signature facial. You can come in once a week if you really want a facial. But for the other treatments, I do recommend coming in once every 3 weeks because you have to give your skin time to rest and rejuvenate and heal from what we just put it through, basically. So once every 3 weeks, I would say.
Okay, yeah, I agree because I noticed after about 3 weeks, I was like, "Oh, my glow is it's not the same." After I first got it done, with the mask on, people were looking. It was like, "Oh,
Right.
you look good. What are you doing?" I'm like, I
Right.
got a facial. Is my face dirty? Like,
Hmm.
what is really going on?" Everybody was like, "Oh my god!" And
Right.
so when you go in, you start liking those compliments, and so when they start fading, you're like, "Okay, maybe it's time for me to go back in for another
Yeah, it's
facial,"
time
because
to go back.
everybody was just gazing in my eyes and telling me I look so good. Patients like, "Doc,
Right.
what you doing?" I'm like, "I got a facial."
Uh-huh.
And so couple
Yeah.
that with some of my dry eye drops. I put some lifting drops in and the
Hmm.
anti-redness. I guess I was like, I need to go on a date
Right.
tonight. Everybody
Whole
tell me
new
I'm looking
me.
good. I need to call my husband. He take me somewhere. So
Right.
everybody compliment me. So kudos to Shabri. That's why I was like, I need to
Right.
get right back in here. So that way I can get back on those compliments. I guess that it was definitely working. And so just like with dry eye, a lot of times you don't know how you look or how you're being perceived because you're just so used to dealing. And then when you go
Hmm.
have something done, so like patients, they have their eyes treated for dry eye, and everybody say, "Oh my God, your eyes look so good. They're not as red." And you're like, "What?" And same with the skin. And so
Right.
that's an important take home that sometimes you don't really know how you're being perceived. You're just so dealing with whatever you have going on that that's why eye care equals self care. So when you come in to get your eye treatments, there is
Right.
opportunity for self care. And some of these treatments you can have done on a day an exam. We had a patient on Friday who came in for an eye exam, met Shabri, and next thing you know, she was laid up in a chair getting a facial. And so
Right.
that's exciting opportunities for us to be able to do that. So Shabri, tell them what days you are in the spa, and then I'm gonna do a raffle. So tell them what day you're in the spa.
So I will be there Tuesday and Wednesday from 10 to 6. I will be there Friday 8 to 5, and then the first and third Saturday 9 to 3.
9 to 3. So we got multiple days there. So y'all come on in, get ready for this holiday season coming up. Everybody's about this new year, new you.
Yep.
And then don't do nothing to be new. So get started. I already got myself planned out for New Year, new me. I'll be new in the new
Right.
year. And so one thing before we do the raffle, because I do want to ask this, which one
Hmm.
of the facials will be the best to help a client? Is that beeping for my to keep their glow during the winter? Because everybody's talking about the glow and the glow up. Which one, what do you recommend would help them keep their glow through the fall and winter months?
So, as the winter creeps in, we're facing colder weather and lower humidity levels, which means it's drier air. So, this is why you feel like your skin is a little bit drier during the winter. So I would choose our dermaplaning facial and also our oxygen facial. Um, Dermaplaning, I chose that because the winter doesn't really, or the weather doesn't really have like it's not a factor in receiving the treatment. So, like I said earlier, with this one, you're removing the top layer of the skin. So you're going to automatically have that glowy, dewy look. And it's also going to make you more able to absorb the hydrating and moisturizing products that you need in the winter. And for the oxygen facial, like I said earlier, the colder the climate, it leads to drier skin. So facials that add moisture to the skin are always better for the wintertime. So those are the two I would pick.
So moisture. Eyes no different. Some moisture. Treatments that are going to add moisture. So any treatment that's going to work on your oil glands to help your tears stick longer, add more moisture, are going to be good for the winter months. Okay. So before we dip out, I do want to do a raffle. And so if you put in the chat, you're going to pick a number 1 through 10. And our first one is going to be we'll do the dry eye kit first. So we'll raffle off a dry eye kit. And that kit is going to include a recommended warm compress, recommended lid cleaning gel or wash, and a preservative-free tear. And so if you're still on, go ahead and put a number 1 through 20 in the chat. And if not, I'll keep it for myself because I know I have dry eye. So 1 through 20 in the chat. See if we get anybody in here. 1 through 20. Everybody being shy. 1 through 20. You're out here. We had a lot of questions. I guess people don't like freebies. Okay, so might put one in 19. Anybody else? Going once? Going twice? And so the number is 16. And so one person put it in, so therefore they get it. They get the dry eye kit. And let's see here. I want to see. She participated, so she's going to get the Hydrofacial too. Keep it simple. Keep it simple. Let's hide this. All righty. And so I'm going to close up. We did our raffle. And so, woohoo, Janet White, she is going to win the Hydrofacial as well as the dry eye kit. And so I'll reach out to make sure that we can get those things to her. We're probably going to do one more show before the end of the year. So I'll be back next month. And so stay tuned to see what that topic is going to be about next month as we get ready to lead into 2022. So thank you all for joining. Great questions that were being asked. I hope everybody got something from our talk today. If you are in the Atlanta area, live here, if you're visiting, whatever, doesn't matter, visit www.premierdryeyespa.com to see what services that we offer, as well as you can schedule a service. We do offer an annual membership. The annual membership is on sale. It's typically $99.99 for the year, but it's on sale for $69.99. That membership is going to entitle you to discounts. Anytime you have a service, you're going to get an array of discounts in the spa, as well as on the optical. So sunglasses, get discounts off of designer sunglasses and off a dry eye treatment. So that's a great membership offer. And then lastly, we are offering gift certificates. And so if you want to purchase a gift card for your loved one, not quite sure what to get them for the holiday season or their birthday, you can go on our website there as well and purchase a e-gift card and load that gift card up. And they can come in and pick whatever service they want utilizing that gift card. And so you could do all that on our website on www.premierdryeyespa.com. Once again, I'm Dr. Janelle Davison, the Dry Eye Mentor, and my lead esthetician, Georgia licensed esthetician, Shabri Robinson. She's here to service you for all your skincare needs. We're going to help y'all winterize and glow up for the winter. Right. So check us out in Smyrna. Enjoy the rest of your night.
Have a good one, guys.